All right, welcome back to All Day Live. This morning we got an update from the Department of Employment and Economic Development on the first 6 months of paid family leave in Minnesota. Joining us now to talk more about what this data tells them about how it's working and who it's working for is Evan Rowe, the Deputy Director of DEED, who runs the program for the state. Thanks for being with us, Evan.
Thanks for having us on.
Yeah, let's talk about some of these numbers here. So 6 months in, 75,000 Minnesotans have been approved. And your data says while some paid leave programs have struggled to reach all populations, the data here is suggesting it is doing what it's intended to do, to kind of have a broad demographic reach to those who may not have been getting this benefit through their employer.
That's absolutely right, Rob. Certainly, the national data from the Federal Bureau of Labor Statistics shows that about nationwide, about 25% of folks have access to paid family leave programs. Slightly different numbers for medical leave programs. But now in Minnesota, that number is not 27% anymore. It's much closer to 100% of Minnesota workers. And so what we're seeing in the data is that Minnesotans of all economic backgrounds across all sectors now have access to this program when they need it for caring for themselves, caring for a loved one, welcoming a new child into their home. And we've certainly seen strong interest and strong uptake in the program since the formal launch on January 1st.
Okay, so we'll get to some of the way the money's being paid out and replenished. Let's talk first, though, again, more about some of these demographics that you had talked about today. 54% of applicants of the 75,000 that have been approved, 54% of the applicants make less than $78,000 a year, 58% under the age of 40, 44% outside the Twin Cities metropolitan area. What does data like this tell you?
I think what this data really shows is that all Minnesotans are able to gain access to this program through this, right? The fact that low-income Minnesotans are able to take the time they need just the same way that higher-income Minnesotans have been makes a big difference, right? If you have a serious health condition, doesn't care how much you make. It doesn't care about your age. It doesn't care whether you're man or woman, right? Like what this program really means is that all Minnesotans, the workforce, have access to be able to take care of themselves and take care of each other in a way that they didn't before.
Do you have any data, though, telling you, so, you've got, 75,000 approved. You talk about the percentage of applicants. We have the number of approved. What's the difference between how many have applied and how many have been approved? Are there a number that are not getting approved?
Yeah, in general, so this is a pretty ballpark number, but around 3/4 of applications are approved, and then some applications are also withdrawn. Say if somebody has a medical event that no longer clears up before they need to use the program, for example. And the most common reason for an application being denied is they don't have the documents that we need to verify the need for leave. I think you're well aware that we take program integrity really seriously at this agency across the state, and we need to get documentation from a medical provider if it's a leave for somebody's own health or for caregiving. We need information about the birth of a child if it's for bonding leave. So we take those responsibilities really seriously, and we follow up with applicants, and we try to make sure that it's as simple and straightforward a process as possible. But we take that responsibility to run a tight ship and run a program with integrity really seriously. I think that's what Minnesotans expect us to do.
Yeah, and certainly now more than ever with fraud concerns among social service programs and benefit programs being such high profile. So the question that a lot of people probably have is, in light of some of the other concerns or investigations we've seen, what do you do in this program to ensure that people aren't taking advantage of it and fraudulently obtaining benefits?
Well, it's a multi-layered approach, Rob, and really what it comes down to is making sure that we have strong controls on applicants when they're submitting their information. We get information from the employer, we get information from healthcare providers, and we use a lot and we leverage a good amount of administrative data to do checks in the background, to review elements of those applications. It's a solemn responsibility that we have, and we, again, take it incredibly seriously.
Okay. And then lastly, I want to get into some of the money elements of this. Nearly $600 million now paid directly to Minnesotans on approved leave that come from a benefit count established, the money collected. Where does this stand in terms of what was expected to be paid out, and how has this impacted the pot of money that is there and available?
Yeah, so the 2023 legislature approved basically an initial appropriation of about $670 million to pre-fund the program, pre-fund those first set of benefits that we're paying out, and then on an ongoing basis, we collect premiums every quarter from employers and employees. Those get remitted every quarter. So again, yes, as you noted, for the first 6 months of the program, we've paid out just shy of $600 million of benefit payments. The first quarter, we collected about $340 million in premiums. We'll collect another batch of premiums later this month. So it's obviously something that we're watching very carefully and closely. But overall, interest in the program has been really robust, right? We've, as you noted, we've approved nearly 75,000 people as of late June. But overall, right, program is running largely as expected, and we're really working hard to continue to make it run as smoothly and as boringly as we can. We want Minnesotans to be able to rely on this program when they need it. We don't want them to have to think about it. We want them to be able to apply to us and take the time they need to care for themselves or for a loved one.
Yeah.
And
boring is better in that case, as long as it's working. Does this, you have to look at this every year, though, and the reason I ask about the way the funds are going out and coming in is this is something that has to be then reevaluated every year to make sure that you're taking in enough to cover it. Is this something where have you been taking in enough then, or are we taking in more than we need, and what does that impact next year?
Great question. We work with an independent actuary to review the program's financials on that. And again, in the first 6 months of the program, right there, it's a new program, and some of the data are still settling out. Obviously, application trends are changing a little bit. One really positive thing is that we in implementing the program, we were allocated implementation funding to build out the systems and the tools and hire the folks that we need to run the program. That part came in $70 million under budget. So that's a really positive impact. I think that'll help us. But we're working with the independent analysts who will make recommendations and help assess that as we look towards next year.
All right, Evan Rowe, the Deputy Commissioner with the Department of Employment and Economic Development, with an update on paid family leave in Minnesota. Thanks so much for the time.
Thanks for having me on, Rob.
You bet.